Sama-san. Hello, good morning, everyone. Let's see, let me get my screen back up here. Come on in, get settled, make sure you have your coffee and your tea and whatever you need. We're just gonna if anyone would be interested, I'd love to hear where are folks coming from. All over the mid-Hudson Valley, that's for sure, but let's see in the chat. I always love to see where some people are coming far and wide, I think. We might have some St. Louis people in the house, some Marylanders. How do you say that, Carol? Does that be Marylandites?
Marylanders.
Marylanders. We're just waiting here to make sure we can have as many people logged in as possible. There's someone from Carmel, New York, Rosendale. I know we have some New Paltzers in the house. All right. Okay, I'm just going to keep an eye on the waiting room here as folks are still filtering in, but we should go ahead and get started so we stay on track. Okay, I'm gonna have to do double duty here. This is not good for my ADHD. This is not good. All right, so welcome everyone to the Learning Lab. Oh, I see Newburgh, Catskill. This is good. Beacon, Tilson. Come on in. Ulster County, Marlborough. I always trip on that one. Marlborough. All right, almost all here. This is great. We have such a good turnout today. Over 30 people coming today. It's wonderful. It's great to come together and learn something new as a group. So welcome. My name's Ashley Walco. I'm the director and owner of Infinity Mental Health Counseling. I'm going to kick us off today by telling you a little bit about Infinity, about the Learning Lab, a little bit of housekeeping notes, and then we'll hop in to the main event. So, and you'll see people are still coming on in here. There we go. Okay, so good morning, welcome. Thank you everybody for coming. I'd like to go ahead and just tell you a little bit about Infinity. We're a group practice. We're located in New Paltz, New York. We work as in a hybrid model. So we see folks both in person and virtually. I have to tell you, never in my wildest dreams would I have imagined that I'd own a group practice that had anything to do with the internet. And now here we are. We are a group practice that works with children, teenagers, young adults, middle-aged folks, really the whole lifespan. Couples, families, we have some groups running, DBT group, women's group, and cycling some new groups all the time. We offer walk and talk therapy here at the rail trail in New Paltz. And we're really dedicated. We're a dedicated team, dedicated to our group as a unit, and also obviously to our clients. So very happy to see so many of you from Infinity here today. Thank you for carving out the time. We also, something special about our group is we offer these learning labs, and you're here today at our spring learning lab. We host them 4 times a year. So you could look to see our summer learning lab would be coming up around July. If you'd like to be sure that you're on our mailing list, you can just chat me your email to make sure that you know about the other ones coming your way. And it's a very exciting time to come together at the Learning Lab because it really hits on the core values of our group, which are top-notch service, relationships, continuing education, and finding joy at work. So without any further delay, actually, one more thing on a further delay, some housekeeping notes. So before we go ahead and hear from Dr. Cal Robbins, just a quick couple of notes. We are recording this today. If anyone's interested in purchasing the recording afterwards, just please email me and let me know. We will be sending out the slides, so don't worry. You don't have to feverishly take any notes today. We're going to be sending them your way. And if you have a question that pops up during the presentation, please just chat it in the chat box, and Dr. Robbins will try her best to read the question and assess if it's a good time right there and then to answer it, or save it for the Q&A, or address it in a future slide. So again, if any questions pop up, you can just put them right in the chat box. And other than that, let's go ahead and learn about who we're hearing from today, Dr. Carol Robbins. Hello, Dr. Carol Robbins. Dr. Robbins is a licensed clinical psychologist. She specializes in the diagnosis and treatment of ADHD across the lifespan at Annapolis ADHD Center, and that's in Maryland. Dr. Robbins has served as coordinator of the Anne Arundel County, Maryland chapter of CHADD. And I said, what is that? She explained it's the Children and Adults with ADD organization since 2002. She has given numerous presentations on ADHD to schools, government agencies, the APA, the MPA, which is the Maryland Psychological Association, corporations and organizations internationally, and she's spoke at a number of conferences as well. She's authored journal articles and book chapters for professional publications in the field, and she's the past president of the Maryland Psychological Association. She was also the coordinator of the MPA Postdoctoral Institute on ADHD across the lifespan. Dr. Robbins is also a licensed provider of CogMed, working memory training, and trained Imago relationship therapist. Personally, she is married to a spouse with ADHD and raised 2 children with ADHD. So I think we can go ahead and get started whenever you're ready.
Okay, well, I'm going to take a minute to share my screen with you, and we've got lots to cover today, so I will try to cover it. And again, you don't need to take your notes because you will get copies of all of these slides. So welcome everybody, good morning, and get ready to be blasted with information. So the title is a comprehensive neurocognitive approach because it is important to kind of think about approaching people with ADHD differently than in some typical therapy models. And this will be explained further in the course of the presentation, and as well as how to define neurocognitive. But at the moment, I'm going to move on to the outline of the presentation. And here is the overview. So we're going to talk about the neurology and key features of ADHD, and then how do you make the clinical diagnosis if you're interested in trying to figure out if your clients might have it. Then I'm going to explain the neurocognitive treatment model and talk about different ways to treat individuals with ADHD by optimizing their brain functioning and by teaching them compensatory and executive functioning skills. So that's sort of a general outline of where we're going today, starting with digging into defining what is ADHD, because there are many myths about it that I want to kind of dispel for you. It is a developmental disorder of self-regulation. That's really the bottom line. And it's self-regulation across multiple domains, including behavioral self-regulation, cognitive self-regulation, and emotional self-regulation. And many people don't recognize how important the emotional dysregulation piece is to defining it and also understanding and diagnosing it. And we'll go into more detail about why that is. But it is a neurobiological disorder of the brain. And the main underlying chemical difference is a lack of dopamine availability. And there are both chemical and structural differences in this different brain. So symptoms in general include problems with attention regulation, impulse control, activity level, arousal, emotional control, and executive functioning. So this is a sort of a model of a cartoon, actually, at the sort of site in the brain where the neurons are releasing these microdots of chemicals. The red dots here are dopamine, and they get released, and some of them will cross over and activate the receptor site of the receiving neuron. But some of them, before they cross over, will be sucked back in through these green things called transporter proteins. They attach to the dopamine, they bring them back up They get repackaged in these vesicles and re-released. This is called a reuptake process, and it in effect traps the available dopamine at the synapse. That is the underlying chemical explanation for the lack of dopamine availability in the brain. And when we get to it later with the medication piece, I'll just say it now because of this picture being here. What the medications for ADHD do, the stimulants, is stop this reuptake process. They stop the transporter protein from attaching to the dopamine and bringing it back in, allowing more dopamine to cross over. So that is why it is a chemical issue, and there is, thankfully, chemical solutions. So this is a brain scan taken by Dr. Daniel Amen, and it shows the pre and post-medicated brain. So what I want you to see is up here, and these are the frontal lobes, and you can see that they are, they look like holes, but they're not, legitimately holes, but they're colored that way to represent underactivation chemically. So they're kind of like offline, and that is a result of the lack of dopamine availability. And then here you can see that once it's treated medically with, in this case, dexedrine, it activates those regions, even in the lower, we're going to talk about the different regions beyond the frontal lobes that are impacted as well. But you can see a much, much more activated brain in this lower slide. Same brain on and off medication, just to show you that it really is a chemical issue and not just a personality, lack of energy or motivation or laziness or anything like that. So as I mentioned, the attention network includes more than just the frontal lobes because it starts with the brainstem, which is where the arousal is located. So some people are hyper, some people are under aroused, and we'll talk about that later. And then the caudate nucleus, the thalamus, the limbic system, which is the emotional center, memory centers, and then the frontal lobe. So this is a systemic issue that's affecting many parts of the brain, not just the frontal lobes. So the brain underactivity in the prefrontal cortex, especially in response to intellectual challenges, there's an underactivity. So when this brain is asked a question, let's say a kid's in school or in college even, and they're suddenly called on to answer a question, their brain almost freezes, and normal brains will be activated to respond, but a ADHD brain will actually show further decreased activity in those areas rather than increased activity. So the basal ganglia, another part of the brain, is smaller in people with ADHD, and that's where a lot of the dopamine is produced. And they have a lot of nerve tracts that go through the limbic system to the prefrontal cortex. The limbic system has to do with the emotions, and we're going to talk about the emotional aspects as well. So when there's not enough dopamine available, there's not enough fuel to drive the frontal lobes, which is what is needed to activate concentration and focus. So it's chemically understimulated and looking for stimulation. So the fact that those two holes kind of in the frontal lobes suggest is that the brain is understimulated, it is bored and looking for stimulation. And that is why people will self-stimulate, not intentionally, but that's what happens because their brain is looking for stimulation or activation, and what they're doing is not stimulating enough. So they will tap something, tap their foot, fidget with something, twirl their hair, play with a gadget or fidget toy. That's all a form of self-stimulation to make this brain pay more attention. But this brain can also hyperfocus on something that's very stimulating to it. So it's not just, some people will say, well, my kid's being lazy because they can pay attention to video games, but not their math homework or their English class. But that's because the video games are actually stimulating to the brain and activate the dopamine system. So there are certain things which I'll teach you later that you can do to help your clients activate their dopamine system. But it's not something that people choose. Like you don't choose to not be bored, like at a meeting. So these individuals tend to lock onto things that are really stimulating to them, whether it's video games or a really good book for some. And then they can hyperfocus and be so focused that they don't even notice the passing of time or hear their name, and they get kind of locked in. So it also explains why individuals with ADHD tend to procrastinate. It's because they need enough stimulation to activate that part of their brain to get started on doing something. So the looming deadline provides that optimal source of stimulation when it gets close enough, not so far away that it's not really going to get their attention yet, and not so close that they're going to panic because they can't possibly get it done before the deadline. So it's a very useful strategy to have deadlines to help optimize the brain in order to get it to activate and work on whatever it needs to work on. And also, this brain is seeking dopamine hits. So it explains a lot of dopamine seeking behavior, like food. Food is a very accessible dopamine available, item. And so people will graze out of boredom. They'll seek carbs to get a dopamine hit. Same thing with scrolling on the phone. That's a big dopamine hit for a lot of people. Shopping, gaming, all of that. So pay attention to when your clients talk about doing these things, because this is a typical dopamine seeking behavior. So there are differences in the brain, not just in the executive functions and the frontal lobes. There are changes in gray matter, white matter, and the functional connectivity between regions of the brain. There's a thinner cortex in the default attention network, which is the monitoring of internal states. That's why self-regulation and self-monitoring is weaker for these individuals. And the limbic networks have a thinner cortex in that region. The visual systems are also affected. There's a reduced size of the frontal lobes by about 7%. And nothing to do with intelligence, just connectivity. We'll have fewer connections. And there is a delay in development of certain brain structures by an average of 3 years. So often you find immaturity in young people with ADHD. They tend to be about 30% below their chronological age range peers in their emotional maturation. And that's why it's harder for them to launch, and it takes longer for them to launch into adulthood. All right. Barkley is a very well-known expert in ADHD, and he's done a lot of research on it. He had a brother with the ADHD who ended up dying as a result of some of the impulsivity. So he became very inspired to help other people be productive and healthy with their ADHD. So he describes these key deficits. Behavioral inhibition is one of them. So there's an impaired response inhibition. Poor impulse control, difficulty delaying gratification or resisting distractions. So that's a really important element of it. And then there's the sustained attention or persistence of effort to tasks. So if tasks are particularly boring, mundane, tedious or repetitive, it's very difficult to sustain attention and effort in completing them. That's why people get sidetracked. They start doing the laundry and then they notice something else and they shift to something else, and then, something else gets their attention, and it's not a very engaging task. And then the regulation of one's activity level to the demands of a situation. So there's a lot of sort of task irrelevant activity that happens, and restlessness that gets in the way of task perseverance and completion as well. Then there's the working memory aspect, and this is often impaired in its capacity to hold information in mind. And so remembering to do things, losing track of their goal, acting without thinking it through, being less able to anticipate or prepare for future events, problems with time management and organizing themselves for upcoming events. And then reading comprehension. When you read, you actually have to hold the information in mind as you read the rest of the sentence and the rest of the paragraph. And that can be very challenging. And many people with ADHD have to reread material multiple times to get it to stick, unless it's a gripping novel. But this is more like a textbook or something like that they might have to read. Then there is a delayed development of internal language and rule following. So this is that kind of personal speech that we all have that kind of guides us and helps us with self-regulation. And they are not very good at that. They don't really read and follow directions carefully. They don't follow through on their own plans or rules or to-do lists. And they sometimes, don't act in ways that follow their own principles. So another area, as I mentioned, I would talk about more is emotional dysregulation. So they have a less ability to internalize and moderate their feelings. They tend to be less emotionally mature and more reactive. They feel things so much more intensely than the average neurotypical brain. It's almost like they get flooded with it, and it feels like even a little tiny thing will feel bigger to them. So they're kind of dramatic in some ways, even if it's just internal as opposed to an externally dramatic person. They experience it with much more intensity. And more external with it, they might look hot-tempered, hot-headed, easily frustrated, impatient. They tend to, have less willpower and self-discipline. And sometimes it's difficult even for the ones that are more under-aroused, because arousal is on a continuum, and some people with ADD are over-aroused, some are under-aroused. So we call those the couch potatoes, the ones that have a hard time activating themselves, getting out of bed and staying awake, and they're kind of daydreaming and in a fog and bored a lot. So that's part of the dysregulation as well. And then they tend to have a diminished problem-solving ability and flexibility. So they give up on their goals in the face of obstacles. That's a really common problem. As soon as they run into an obstacle, they don't persevere and try to solve it. They just drop it and go to something else. They tend not to take time to think through the other options. And they may appear less flexible in approaching the problems and more likely to just respond impulsively and less creative at overcoming the roadblocks. So they tend to kind of get stalled out and not follow through. Their work performance as a result is very variable. So there are wide swings in the quality, quantity, and even the speed and the efficiency of their work. Often if they're doing something, they're tasked with something that's interesting or engaging for them, they can stay on track and be very efficient and productive. But for most of us with jobs or school demands, there are going to be times when it's not particularly engaging work we have to do. And that's when their job performance is very variable, and they get distracted and off track and sidetracked, and they become very inefficient and they miss deadlines and that kind of things. Same thing with their tasks of daily living. They get sidetracked cleaning or meal prepping or doing laundry or whatever else they have to do in their homes. So the common, effects of all that is that you're going to have dysregulated attention, problems with emotional regulation. The top-down control has to do with the fact that our emotional regulation really stems from the prefrontal cortex regions that are underactivated because of lack of dopamine. So there's less ability to calm oneself down when one gets triggered at the lower brain levels, like where the amygdala is in the emotional brain regions. When those get triggered, they flip their lid because there's no top-down control to regulate that, to down-regulate it. Then they also develop the impaired executive functions and their problems with activation, arousal, and motivation. And often this impacts their social skills and their ineptness, if you will. Some, again, are so we see both sides of this one. We see some people with ADHD, they're socially almost gifted, they're gregarious, they're charismatic, they can charm and talk someone into anything. And then you have those that are pretty clueless, that miss social cues, that just don't seem to pick it up and are so focused on regulating themselves that they don't tune into the other people as well. And that can cause trouble socially. So let's talk a little bit about what executive functions are. So these are some of the core ones. Activation, so being able to initiate action, to organize yourself to do something, to prioritize a task and activate yourself to work on it. Focusing is, sustaining and shifting your attention as needed to the task at hand. Effort is just regulating your sustained effort and alertness and your processing speed. And then the emotions I mentioned, managing a frustration or an obstacle and modulating your emotions and reactions to that. And then the working memory issue and action, just taking action, monitoring and self-regulating your own actions. So these are all areas of weakness for most people with ADHD. And more on Barkley's definition of some of the dysfunction. I like this quote: self-directed actions needed to choose goals and to create, enact, and sustain actions toward those goals. So that's sort of how you define overall executive functioning. And it correlates highly with overall impairment in adults. And it is not always sufficiently remediated by stimulant medication, although stimulant medication helps significantly for most of my clients. So again, the key symptoms, just to review, are, the inattention, things like daydreaming, mind wandering, making careless errors, overlooking details, the distractibility, being, easily sidetracked, difficulty concentrating around noise or other stimuli in the environment, and getting back on task after an interruption. So if the phone rings or someone walks in their office, it's really hard to get back on track, and they tend to lose a lot of time in those circumstances. Hyperactivity for some, there's motor restlessness, talking too much, too fast, doodling, tapping, swinging their foot, just having a hard time sitting still, being kind of bouncy and energetic. And then the impulsivity, interrupting, blurting out, making risky decisions and risky behavior, impulsive spending and impulsive eating and shopping and scrolling and gaming and all of that. Organizational difficulties are very key for many people. So they have a hard time keeping track of things. They tend to be messy and forgetful and sort of disorderly and cluttered, and they don't file well. They sometimes don't open their mail and it piles up, and they forget to pay bills. They tend to be inefficient, as I mentioned earlier. There's reduced productivity, feeling easily overwhelmed by demands both at home and at work, taking long tasks and not being persistent with them. Poor time management, they tend to run late, to overcommit because it's exciting to say yes to something, and then they don't realize at the time that they can't really get it all done and fit it all in. They underestimate how long things will take them. They tend to dawdle on the way to get out the door to go somewhere. They put things off. They try to squeeze in one more thing. And have a poor perception of time. So there's kind of a time blindness element that's really important to understand. Time is very elastic in their mind, and they really don't have an accurate sense of the passing of time. It really depends on how stimulated they are. So if they're super stimulated with something, 2 hours can seem like a minute. And if they're bored, and then they have problems making decisions. They get overwhelmed by choices and have a hard time prioritizing and eliminating options because they want to do it all. Planning difficulties is common too. They tend to react to daily events rather than plan their day. They tend to have trouble managing things that require planning, like meals or social activities, and they end up feeling very overwhelmed. So the word overwhelm, so I wrote some webinars and materials for people in midlife with ADHD, and I call it frenzied, frazzled, and overwhelmed, because that is exactly how these individuals feel when they don't get treated. So if you hear your clients talk about feeling overwhelmed, think in your mind, I wonder if they might have untreated, undiagnosed ADHD. They have problems initiating, persevering, and completing tasks. So tasks get put off and avoided, and many are sort of unfinished in the middle of being attended to. They drop hobbies, they get all excited about one, buy all the equipment, and then they lose interest because novelty is more stimulating than, continuing a hobby. So that's a problem for them. Then stimulation and arousal, I alluded to before. They do get easily bored because their brain is chemically bored. And they do thrive on stimulation, on change, novelty, that kind of thing. But they can also be sensitive to overstimulation. They can get bombarded by stimulation. They tend to have more sensitive wirings, and so many of them will be more impacted by stimulation than the average neurotypical brain. So they might be more overwhelmed by too many people, too much noise, certain kind of lighting, certain situations are too overwhelming. They also have under arousal and over arousal issues. So some of them will need naps or feel low energy and kind of more like a couch potato versus the ones that just can't even slow down and relax, even on vacation. So you see both. And that's why it's tricky to diagnose sometimes, because you see both ends of that spectrum on arousal. So these are the subtypes that you see in the DSM. The predominantly hyperactive impulsive type, I am not sure that I've ever truly seen just the hyperactive impulsive without any of the others, but it's in the DSM, so I'm going to tell you about it. So it's primarily difficulties with the impulsive and hyperactive behavior and not with attention or concentration. To me, I'm not sure that that exists very often. So the predominantly inattentive type you're going to see a lot of. They're significantly inattentive without being necessarily very impulsive or hyperactive. But I would say many more people are the combined type. However, they outgrow some of the impulsive and hyperactive behaviors from their youth, so they don't look as much that way, but they're actually combined because they've had features of both in their lives. But this is common, and sometimes the preschoolers will look like they're just hyper and impulsive, and then it becomes more obvious that they have the attention problems as they mature. So the predominantly inattentive type is a little bit different than the combined. There are some qualitative differences. So they have more of the daydreaming, sort of passive, sluggish hypoactivation or arousal. So that's a little different. They tend to have trouble filtering important information from unimportant information. They process more slowly. They take more time to get things done as a result, and they have more kind of mental fogginess and confusion. They can be very socially quiet or apprehensive, and they tend to be inconsistent in their ability to retrieve information from memory. So the etiologies of ADHD, genetics is really the main cause. It is a highly heritable disorder. And these are some of the reasons. You'll see that with twin studies, and most of the time you're going to find relatives. So it's always important, which I'll get to later when you diagnose it, to ask about relatives. And then there are other causes like substance abuse that damages the brain when the mother who's pregnant is using a lot of alcohol or cocaine or crack or lots of cigarette use. And then, of course, there are toxins in the environment that can disrupt brain development, like lead. And premature births and significantly low birth weight and postnatal injury to the prefrontal regions of the brain are other potential causes of ADHD. But again, 80% or more is genetic. So, this is from Barkley again, who likes to help people understand the outcomes are not pretty if we don't treat it. So whether or not they have the full syndrome in adulthood, at least 50 to 70% may continue to manifest some symptoms that are causing them impairment in their adult life. So we used to believe that children outgrew it and that it was only a childhood disorder. Thankfully, over the last 20 to 25 years, we have learned differently. And I was sort of on the vanguard of that, of recognizing that adults, in fact, still have it. So you're born with it and you die with it. The problem is that it can change in its presentation over your lifetime, and it can look and feel less like you have it at times. So it's about failure to fully meet criteria versus having it and not having it. So you can be subclinical at certain times of your life. So with maturity, with hormonal changes, with circumstances, with environmental changes, all of that can change how much it impairs you and how ADD you look. But if you're born with it, you still have it. Technically, your brain still has the changes that in it that qualify you to have the diagnosis, but you may not be as impaired for all these other reasons. So approximately 10 to 25% develop difficulties with overuse, dependence upon, or even abuse of legal or illegal substances. So this is really because their brains are seeking something. It's like the brain is bored and they need something to stimulate themselves. And some of them will find these substances. So they're more vulnerable to self-medicating when we don't treat them. All right. So these are some of the downsides of not treating them in childhood. They are likely to be undereducated relative to their intellectual ability and their family educational background. They will tend to change jobs more frequently and be underemployed compared to their intellectual or educational capacity. They have a greater turnover in friendships and dating relationships, more marital discord and divorce, higher incidence of traffic violations, speeding, accidents, traffic citations, etc., and a greater difficulty managing their finances. So you're going to see more credit card debt and overspending and forgetting to pay their bills, forgetting to file their taxes, and even bankruptcy and foreclosure. So these are the downsides of not treating it for some of them. But there are also some possible attributes, because it is the creative brain. And without this brain, we would not have all the inventions that we rely on throughout history, including computers and telephones and all of the things, airplanes, including music and art. This is the creative brain, and it's an important part of history and society. This is the brain that thinks outside of the box. So it is inventive and entrepreneurial and artistic and musical and visionary. They're really good in crisis management because their brain gets lit up, fully activated in a crisis. And as opposed to some neurotypical people who get flooded and flustered in a crisis, these brains get activated in a crisis. So you see a lot of first responders, ER doctors, and nurses have this brain. They have a lot of determination and drive and ability to hyperfocus, which can be really helpful. They can be adaptable to change and have a preference for it because they seek novelty. They can have a good ability to then deal with whatever comes at them. And again, this is not everyone with ADHD. They can have a strong intuition and perceptual awareness. So they go into a room and they can perceive what's different in the room more readily than some neurotypical brains. They can multitask to some degree. It's not perfect, but they have a little more ability because they are understimulated. They find multitasking more stimulating. So I remember when I used to read to my daughter at night when she was younger, she would find just my reading the story not stimulating enough for her. So she would then take a notebook and she would write with her non-dominant hand just to more stimulate her brain. And some of them, as I mentioned before, can be very socially astute and charismatic. So that can be a benefit for some career paths. And we could call them distractible, but they can also be super observant. They can be hyper, but they can have a high energy level, which can be great for stamina and for doing a lot of good work too. They tend to have an inattention to detail, but they can see the big picture sometimes. They are great visionaries. They can be impulsive, but they're also capable of quick responses, hence, good in a crisis. And they can be impulsive, but they're also, they can have internal distractions, but they also have a really rich imagination. And that's another sign of sort of visionary, creative types of capacities. And as I mentioned, it's an important brain throughout history. So we need to help these individuals to, maximize their potential and to minimize some of the ways in which this negatively impacts them. All right, so now I'm going to dive into diagnosing it. How do we decide if someone has ADHD? And I don't expect you to become an expert based on this, but this is sort of the guide to how to do it if you choose to do it. It is an art and a skill, and it does take a lot of practice to get it right. But I'm going to share it with you anyway. So a detailed clinical interview is an important part of this, and it needs to include the developmental history of the individual, the medical history of themselves and their family, their current symptomology, school and job history, and possible comorbidities. There are important self-report diagnostic measures because unlike with children, you can't just base it on observation. There's a lot of internal experiences that only the individual can report upon. So there are some good diagnostic inventories that are useful in, getting at that. And it's also useful to have others. So if it is a child or they're in college or something, having teachers or parents or others, spouses, report measures are very useful because not all people are self-aware. So having someone else in their environment notice some of these things is helpful. And then there are medical issues that need to be ruled out sometimes. And some people find it helpful to have a QEEG, which is a quantitative electroencephalogram, which is a brainwave map, or a SPECT scan, which is those images I showed you earlier of the brain. The SPECT scans are very expensive to obtain and generally only advised in extreme cases where there's sort of complications and not plain vanilla ADHD. So other assessment measures can include behavioral observations, especially in like a school setting, speech and language testing, occupational therapy if there's sensory integration problems or gross motor or fine motor issues. Vision and hearing testing is important for younger kids if they might have issues there. Some people will do neurological exams if there's neurological issues as well. Some people will do neuropsychological or psychoeducational testing. It is not required for the diagnosis. It's an expensive, time-consuming process. So I want most adults to understand that you don't need testing in order to be diagnosed with ADHD. So there's a clinical assessment, and then there's the whole testing battery. Testing batteries take 6 hours, and then there's a lot of write-up and time on the professional's part to assess and write up the report. So it's cost, and it's time intensive and costly as a result. Some insurance will cover it, but it's absolutely not necessary for the diagnosis. It can be necessary to tease out whether you have a learning disability and to get accommodations for testing or for college or high school. And then there's some computerized assessments that some people use that are continuous performance tests. So you can kind of measure vigilance and attention through those methods. Okay, so medical rule-outs are important to keep in the back of your mind. Some people will have thyroid issues that will mimic some of the behaviors that we see with ADHD, or Fragile X, or fetal alcohol syndrome. These are just different sort of genetic things that can look like ADD, including exposure to lead or mercury. So I'll give you a personal example. People of a certain age, including myself, have cavities that were filled years ago with those amalgam fillings. Well, those actually have some pretty toxic things in them, like mercury and other chemicals, tin. And when they start to leach, which will happen as we age, they can actually affect your brain. And I started feeling like I went into a room and didn't remember why I went in there. And I found out that I had too much tin and mercury, both at different times. And it's because my cavities were leaching. And then I got that taken care of and got detoxed, and my brain came back. So if people have been exposed to lead or mercury or other heavy metals, they can actually feel and act and look ADHD. Same with Lyme's disease. And hypoglycemia can have symptoms similar as well. Then there are people with food sensitivities. So when they're exposed to the food that they have a sensitivity to, they can have symptoms that look ADHD. Certain dyes, for example, or chemicals in the food. Learning disorders, of course, are very much coexisting with ADHD. Sleep problems. So if you have severe sleep problems, it can create symptoms that look like ADHD because your brain is not getting enough sleep and it acts really ADHD. Sensory integration issues are common with this population as well. And there are other conditions that mimic it. And I've given you a link to a place where you can check some of those out if you're interested. All right. So for the criteria, there needs to be a persistent pattern of inattention and or hyperactivity, impulsivity persisting for at least 6 months that interferes with functioning or development. So you need to have, and this is a different one for adults. It used to be 6, and now they've cut it down to 5 out of the 9 symptoms, because a lot of adults don't manifest as many symptoms as they did when they were younger. And we don't want to rule them out as having the ADHD. So 5 symptoms of inattention, or at least 5 symptoms of hyperactivity, impulsivity. And having some of these symptoms present before age 12. So that's where the developmental history is important to ask questions about. And they're present in 2 or more settings, and there's clear evidence that the symptoms interfere with social, academic, or occupational functioning. So there's the combined presentation. So if both the inattentive and the hyper-impulsive criteria are met, so there's 5 and 5, or if there is predominantly the inattentive and predominantly the hyperactive impulsive. So those are the 3 different conditions. But we still need to differentiate between diagnosis and disability. So sometimes the diagnosis is not as disabling, and sometimes it's more disabling, and it exists on a continuum. So you can have a little bit of ADD that doesn't impact you that much. You can have a moderate amount, and you can have a much more severe amount. And also, they used to believe that, well, if you've gone to college or you have a PhD or an MD or an LD, a JD, that you must not have ADD. Well, that is not true. A lot of people who are bright, intellectual, and capable academically are actually stimulated by learning. And so it activates their frontal lobes, and they can do it, but often it's at a cost. And this is the hidden cost that isn't always noticed unless you ask about it, where they work extra hard. They don't have a social life in college because they're working every day, every free moment in order to keep up and do well and achieve the good grades that they are getting. So we have to allow for the possibility of high achievers with ADHD, which I see a lot. All right, now we're going to dive into how do we assess it with a diagnostic interview. So you always want to, if possible, solicit information from multiple sources. So a spouse, a partner, a parent, if it's a young adult or a teacher, if it's, someone in school still, or get access to historic teacher reports, work performance evaluations, that kind of thing. Definitely you want to make sure they have self-report inventories and diagnostic inventories for others like spouses and or teachers. And other inventories, if you suspect they might have anxiety or depression, you obviously want to assess that as well. And I start with asking about the current symptomology, like what brought you now to be assessed for ADHD? What's going on in your life at home, at school, at work? What kinds of self-medication are you using? Because that's often a sign that they're treating themselves, like with a lot of caffeine or nicotine, pot, all of that. Their brain is drug seeking in a sense that it's seeking relief. And so people will find different ways to self-medicate if they're not properly identified and treated. So it's looking at the current symptoms. Are they always late? Are they distracted? Are they having driving incidents? Financial problems. Now, sometimes they'll tell you that they've had problems financially in the past, but now their partner does the finances. So that's an indication too. Clutter, messiness, hoarding, not answering the phone, not opening their mail, and then the stimulation seeking behaviors. So you just want to ask about those kinds of things for the current symptom patterns. And then you want to look at the developmental history, starting with school early on, preschool, elementary school, and up. Ask about what they remember, what it was like being in class. Did they get bored easily? Did they daydream a lot? Were they out of their seat? Were they the last to finish, work that was timed? How was it taking notes while they were listening to lectures? Did they have a really messy desk or book bag or bedroom? Or, what did they struggle in? A lot of people will say math, and yet there are also math geniuses that have ADHD. I'm married to one, so it's not a given, but it's common. Reading is another area of difficulty for some and not for others. Some are avid readers with ADD, and others really struggle because it is more executive function demanding for some brains to read. As I alluded to before, you have to attend to the words, you have to process the words, you have to retain the words, remember them, and then apply them, kind of hold them in mind as you read the next sentence and the next sentence to make sense of what you're reading. And many of them will complain they have to reread over and over again to get it to stick, unless it's a gripping novel or something. So that's good to ask about. Same thing with writing. Many of them have a hard time organizing their thoughts as they write. They have problem with spelling or grammar. Foreign language can be tricky for many. But then again, we see people gifted in these areas. Do they have a lot of variable grades, doing well in the classes that they found stimulating and not so well in the others? It's that variability that often is a hallmark, or doing well only with certain teachers. Did they repeat a grade or need special classes or have tutoring or need tutoring, fail a class, have to go to summer school? Did they forget to turn in their homework, lose their papers, didn't bring home needed materials, go unprepared for class, cram at the last minute, stay up late to get their work done? Problems with doing homework. Did they do the homework? Did they just get by on their intelligence? Many of them get by on their intelligence and they don't have good study skills and they don't really apply themselves outside of the classroom. How do they handle the long-term projects? That's often very telling. And did they take any advanced classes like APs, or did they skip classes? And then, you want to go into behaviors. Were they bedwetters? Did they have trouble sleeping? Did they have picking behaviors, or emotional dysregulation and sensitivity? Behavior problems. Some of them get into fights or have conduct problems or argumentativeness or compulsive behavior, stealing, all of that kind of stuff. A lot of them will lie and steal at home. My son who was to raid my wallet and take out a 20, or they'll lie. And did you brush your teeth? Yeah, I brushed my teeth, and I go upstairs and the toothbrush is dry. No, I don't think you did. So that's very common. Home environment, what kind of structure did they have? When there was more structure, they tended to do better, but you'll see that if the parents also have ADHD, which is common, then it could be more chaotic at home, where there are lots of children, then they may not get the oversight that would have supported them more. How do they do with their friendships and socially? What were some of their peers' complaints? Were they immature? Were they bullied? Could they follow a series of commands, or were their parents constantly having to remind them to do things? And how do they deal with substances? Back starting in middle school, did they try pot or alcohol, or were they promiscuous or reckless? Those are things to ask. And then you do want to also get a complete family mental health history from both sides, mother and father, even if they weren't officially diagnosed. And that'll help you to kind of tease out whether there is a secondary inherited tendency toward anxiety or depression or some other disorder. Same thing with learning or attentional difficulties. Are there family members that, maybe dropped out of college because it was too difficult, or didn't bother to go to school because they preferred to do a hands-on job? Not that there's anything wrong with that, but it can be telling. That's why I say family patterns of employment. So you see a lot of them being entrepreneurs or hands-on people, in the skilled areas like plumbing or electrical or sales or those kinds of things, or realtors, where you don't need a lot of further education and they don't sit behind a desk all day. Then you want to inquire about the medical history of the client on both sides of the family. And that can help kind of guide your treatment and diagnosis as well. So head injuries are good to ask about. Many of them that were sort of impulsive and high energy and hyperactive, fell a lot, or got sports injuries, concussions, that kind of thing. Traumas, physical and emotional, and diseases, illnesses, or medical conditions that they may have had as children. Allergies, many of them have more sensitive systems, as I mentioned before, so they have more tendency to have allergies and asthma and or sensory sensitivities and or food allergies. So you want to ask for family history of anyone with food allergies or food sensitivities, digestive problems, etc. And then developmental problems, whether they have delayed speech, vision, hearing issues, motor issues. And then moving up in age as they transition to college or independence, what was that like? Did they crash and burn freshman year? I restore a lot of them after that happens and help them get properly diagnosed and treated. Did it take them multiple years to go to college because they were dropping classes and not really doing it actively or full time? Did they switch schools or majors a lot? Did they struggle with time management and rely on parents for structure? If they graduated, how did they get through it? What did they do to get through it? Did they pull a lot of all-nighters? Did they have a lot of variable grades or have to repeat classes? Did they turn their work in late? Did they benefit from study groups, or did they borrow stimulants from others? That's really common. Did they have to work extra hard and long? Did sports help them structure their time? Did they use substances, out of control behavior? And how did they manage everyday life in college? Did they lose things? Were they disorganized? Were they, having trouble managing their money or their laundry? And then you move on to work. So you want to work history from first job to current job, looking for patterns of difficulty with authority figures, supervisors, coworkers. Did they have many short-lived jobs? Did they quit or get fired, get passed over? A lot of them don't meet their full sort of achievement level where you would expect them to get. So you kind of look at for underachievement. What kind of performance appraisals did they get or feedback did they receive? What were some of their struggles on the job? And is their work more hands-on or active? Are they a small business owner? You see a lot of that. And then you want to ask about relationships. Kind of what patterns did they have? Are there lots of short-term relationships? Did they get bored and move on? Did their temper get in the way? Were they accused of not listening or not following through on things? Are there unwanted pregnancies, cheating, promiscuity? Do they have long-term friendships? What are common complaints of their friends? Do they maintain contact over time? Often inconsiderate or too late or too blunt or inattentive or not fully present in their relationships. And parenting, if they are parents, inquire about some of the issues they may have with being consistent with creating routines, setting limits, managing their children's behavior. How do they manage meal planning and organizing and all of the chaos that comes with managing children as well as yourself? And often you'll see that adults who aren't horribly ADD, like they're maybe moderately ADD or mildly ADD, they'll do fine until they start having children. So it's one child is a certain amount of chaos. 2 children, exponentially more. 3 children, oh boy, that can really make them fall apart after that 3rd child. So asking about the children and how it was to have, each child, and often you will see a pattern there. So it's already hard for people that are neurotypical, but for people that have this brain, it really just throws them for a loop. Because they have so much more to manage. Not only are they managing themselves and their household, but now they're managing their children's world and school and sports and everything else, their social life, their homework. Do they remember to make doctor's appointments? Big issue for many of them, for themselves and their kids. Self-care habits, really important. Ask about, their sleep patterns. Do they stay up late? Do they end up scrolling at night and binging on Netflix rather than going to bed when they need to? Lack of sleep is a huge problem. And it will, affect them across the board, which we'll talk about later. Ask about their exercise regimen. Do they do it? Is it inconsistent? Do they start on doing it and then they go on vacation and they come back and they forget to pick it up? Nutritional habits, are they so disorganized that they have to grab unhealthy food in order to feed themselves? Do they eat for stimulation? Do they kind of graze when they're bored? Do they seek sweets and carbs? What kind of stress are they under and what do they do to manage it? All right, so that's kind of a dump of the kinds of questions you want to be asking, the things you want to be thinking about as you assess them if you choose to take that on. Or you can refer them out, but at least it gives you a sense of what we look for and what you might want to consider in working with your clients. So we also have to rule out comorbidities and take them into account when we treat our clients. Excuse me. An adult with ADHD is 6 times more likely to have at least one other psychiatric disorder. And of course, that has implications for treatment and prognosis. But it often coexists with a learning disability, an anxiety or mood disorder, or another disorder that dates back to childhood. However, that said, they are often secondary disorders that develop as a result of the untreated ADHD. So a lot of people come to me in midlife complaining about being overwhelmed and stressed. They first went to their doctors who told them, okay, here, have an SSRI, which is like for anxiety or depression. And that may have helped some, but it never addresses the underlying ADHD. So too many of them are undertreated because they come in complaining about the stress and the overwhelm. And so the doctor hears anxiety. And then when you're stressed and overwhelmed for a long time, you end up becoming depressed because it's frustrating, it's overwhelming, it feels hopeless and helpless. And so you get secondary depression. And then when they go and complain to their doctors, especially women, I'm depressed, I'm overwhelmed, I'm stressed, they hear, okay, you got anxiety, you got depression. They try to treat those, and they don't recognize that it's all due to undertreated underlying ADHD. So that's really important to listen for, and you can help a lot of people from not suffering as much if you can kind of think about it that way. And if you hear overwhelmed or stressed, think, let me see if there's ADHD here too. So these are some common comorbidities. The conduct disorder, of course, is in children. Anxiety disorders, mood disorders, specific learning disabilities, bipolar, autism should be on here too, oppositional defiant, substance use, and intermittent explosive disorder. So these are some of the common comorbidities. And then, as I mentioned, there's the secondary diagnoses. So they'll present with these symptoms and they'll be the result of the undertreated ADHD. So keep that in mind. That's so important to assess, especially if you hear the word overwhelmed or stressed. Other common coexisting issues are eating disorders. So many of them will binge eat out of boredom and impulsivity. And you'll see a lot of more overweight people in this category because of that. Because of that difficulty with self-regulation makes it hard for them to manage their eating. And so that creates weight gain and diabetes. So there's really an overlap there. Same with addictions. So they're self-medicating with the alcohol, the nicotine, the pot, the caffeine, et cetera. Addictive behaviors like impulsive spending, gambling, internet porn, et cetera. And anger control. You're going to see more road rage and fistfights and aggression and criminal records in this population. And then there's some bipolar, about 20% overlap. So these are the shared features, because it's can be a little bit tricky to discern the difference. So the shared features are, you're going to see mood instability in both, talkativeness and racing thoughts in both, impulsivity and impatience in both, impaired judgment and irritability in both. They're both a chronic, lifelong impairing course of, continuum, and they both have a strong genetic clustering. And you can absolutely have both. But there's some that have one or the other, and some have both. So ADHD is more likely to be evident in childhood. Bipolar doesn't usually start till later. ADHD is always present. Bipolar is more episodic. ADHD moods are triggered by external events, not by internal changes in biochemistry. And the ADHD mood shifts are very instant in response to stimuli, whereas the bipolar shifts can take days or hours or weeks. The mood shifts for ADD are of much shorter duration, but again, there are 20 to 25% of them that will have both. And many women used to be misdiagnosed as having bipolar instead of ADHD, so that's important to kind of be aware of. At least I still see them come into me. They tend to be, it doesn't happen as much now, but people that are maybe 50 and over may have been misdiagnosed as bipolar when they were younger. There is comorbidity with ADHD and PTSD. So there are shared risk factors and shared genetic predispositions. And as a result of ADHD, many kids are mistreated or abused, or their families are chaotic and there's more sort of abusive patterns, even alcohol use and that kind of thing in the parents. So they are more exposed to some of these situations. And that PTSD can exacerbate the pre-existing ADHD. So that's important to kind of understand the relationship and help address both issues. Trauma reactions can increase inattention, impulsivity, and hyperactivity. Trauma reactions may increase social difficulties and increase arousal, and increase difficulty with concentrating. So when you have PTSD and you're traumatized, you're going to have hypervigilance, anger, and sleep difficulties, and you may be distracted because you're on high alert and you're not really focused on what the teacher is telling you, or at work or wherever else you are. So there are many what I call faces of ADHD, depending on a number of factors. Everyone does not look the same, so you really have to kind of listen for certain nuggets with your clients and be aware of how different it can look. So your intelligence level is going to determine also how the ADHD appears for some, because they will get by on their intelligence and mask some of the difficulties. It also allows them to be more successful if they're of higher intelligence generally. The level of severity makes a difference in how it presents. Their personality style really makes a difference. So the ones that are sort of more perfectionistic, and I call it OC, sort of obsessive compulsive tendencies, not OCD, they tend to be more motivated. They tend to be more orderly. They tend to create more structure and they're more anxious to begin with. And so they're kind of more driven, and they are more likely not to miss deadlines and to have created systems for themselves to stay on track. So that can mask it for a lot of people. So you have to kind of look for that too. If they have this kind of perfectionistic style, that can make them seem less ADD than is really underneath it all. There's variations in arousal level and the need for stimulation, depending on the subtype. And there are coexisting conditions and learning disabilities that can affect how it shows up, and how well they use compensatory strategies and their lifestyle habits that can make some seem less ADHD than others. And the level of structure and support available to them really makes a big difference. So a lot of the athletes do better because they have the structure of the athletic activities, and they have the actual exercise itself, which actually is a treatment for ADHD. We'll get into that later. So look for these different things as well. So the clinical picture, hormone levels matter, and you're going to see a worsening of symptoms in middle age as both estrogen and testosterone levels decline. So a lot of people, especially women, will come to me in midlife complaining that they start feeling more ADHD. And it's not that they suddenly acquired ADHD in midlife. It is that they have been managing it sufficiently, until the level of their hormones have dropped to the point where it's becoming more noticeable. So there are estrogen receptors in the brain, in the prefrontal cortex. And when the estrogen levels begin to decline, there's a whole, perimenopausal period of probably about 10 years. So it can start as early as the mid-30s for some women, mid-40s for others, and others not until later 40s. But somewhere in there, it's going to start happening where the estrogen levels begin to decline. And some people are more sensitive to that. And it kind of exacerbates their ability to manage it all, to keep all the balls in the air, so to speak. And at that time of their life, they also tend to have more demands. So in midlife, we have multiple kids to take care of. We have aging parents to help manage. If we're working, we tend to have more responsibilities at work. So there are more demands on us to begin with. And then when the estrogen levels begin to decrease, it's a perfect storm. And as I mentioned before, women tend to present as overwhelmed, and then they get treated for those things and not for the ADHD. There's also a lot of shame that is a fallout from untreated adult ADD, and that kind of results in low self-esteem and shame and blame, and that is sad, and we need to help women with that as well. So there's a trail of damage behind them many times too, lost relationships, divorces, job loss, underperformance, accidents, substance use, financial insecurity. These are the sort of trail of damage if they come to us later in life. And again, we have to rule out medical conditions and stressors that can look. And now we're going to talk about ways that you can assess them with inventories. So basically, there are empirically validated diagnostic tools, and I've mentioned a couple here, the Brown ADD scales, and it has a structured interview with it. These are ones you can purchase and use. There's Russell Barkley's new diagnostic scales, Barkley Adult ADHD rating scales. The Conners are very common. Conners Adult ADHD rating scale, called the CARS, and the Behavior Rating Inventory of Executive Functioning, the BRIEF. Those are all available to purchase, and you can use in your practice if you want to get access to some of these. There is also a free version. This one is free in the public domain, and it is a symptom checklist instrument to kind of screen for it. It is not as in-depth as the other diagnostic inventories I mentioned, but it is useful for a screen to kind of decide if you need to dive further into assessing it. All right, so I haven't seen any questions in the chat yet, but maybe I'm not seeing the chat. Let me see if I can check in real quick. Okay, so I do see some questions now that I've checked on that. Let me take a minute to look at that and see if there's anything I want to answer now before we move forward. Does trying out medication for ADHD confirm the diagnosis? No, it doesn't. And people react very differently to medication depending on their personal neurochemistry and metabolic rate. So no. I mentioned the self-report measures. Let's see. Why does texting feel so hard for the person with ADHD? That's an interesting one. I have not found that to be the case for most of my clients. They love to text, but everyone's different. We talked about hormones. So the thing about hormones I'll also add to that is that not only is it the perimenopausal hormone changes, but also pregnancy hormone changes. So when a woman is pregnant, the pregnancy hormones actually, for the most part, will benefit ADHD, thankfully, because you can't take stimulants while you're pregnant. So that's good that at least the pregnancy hormones can help. And some women will report they never felt better than when they were pregnant. That's not true for everyone. It can be true. And later and earlier in life at menstruation, when girls begin their menstrual cycles, they actually become more ADHD-like. So we call that ADHD squared as girls start puberty. For boys, it's really the opposite. When boys start puberty, they actually get calmer and a little less hyper and a little more mature. So they can look a little less ADHD. Ironic, but that's the way it works. So the impact of TikTok with ADHD diagnosis, social media, TikTok, all that is a blessing and a curse both. You get more instant information, and a lot of people are finding some wonderful TikTok and YouTube streams and social media access to information about ADHD. People are doing some wonderful things that are very helpful for people, and they feel more connected and less alone in their ADHD. So that can be a good thing. Also, on the other side, on the downside, it's really hard to stop scrolling, and they end up losing sleep because they're staying up, getting dopamine hits by scrolling. All right, let me move on to talking about how do we help them therapeutically. So we're going to talk about something like we call neurocognitive psychotherapy. So I was trained 20 years ago now by a mentor in the field called Dr. Kathleen Nadeau, who has written a lot about it, and I highly recommend her materials. She most recently wrote a book for adults in retirement years, because she is in retirement years herself. And not that she's fully retired, but of retirement age. So she wrote a great book recently that came out this year for adults at that end of life. And she's written great ones for women and great ones for people on how to, an ADD-friendly way to organize your life as well. So this is an approach that combines some aspects of cognitive rehabilitation as well as cognitive behavioral psychotherapy. So we want to work on improving cognitive functioning, helping them develop compensatory strategies, and helping them restructure the environment, because the environment does impact your ADHD. So we're going to improve cognitive functioning through medication, which we'll talk in more depth about, exercise, nutrition, sleep. I kind of decided not to touch on too much the neurofeedback or brain training on this talk because of time, but it can be helpful. Meditation, yoga, Tai Chi, etc. Exposure to nature helps. And then things like tutoring to improve memory, planning, study, and writing skills, remediation, all of that can be helpful. So we're going to dive into most of these. The other part is how do you support the compensatory strategy development? So creating new habits, creating new daily self-care strategies, stress management, coaching, assistive technologies, problem solving, and goal setting. So that's sort of the array of ways that we help people, in addition to restructuring of the environment, making sure that it's low maintenance in the physical environment. In the classroom environment, there are lots of things we can do with accommodations and multimodal teaching, et cetera. The work environment, there's a whole bunch of things you can do there as well. Creating, good social environments where you educate friends and family about some of your ADD behaviors so that you don't get misattributed to not caring because you show up late sometimes, or being not caring because you forget someone's birthday or whatever. So these are new skill sets than typical psychotherapy involves. So starting with reframing the ADD is so important, because many people, before they've been diagnosed, have a history of blaming themselves, being self-critical, and feeling bad about themselves because of all the ways they've struggled. And so it's really helping them reframe their life through the lens of having now being diagnosed with ADHD. And it makes them really understand that it's a different brain they've inherited. It is not a bad personality. It's not laziness. It's not lack of intelligence. It's not stupidity. It's not anything like that. So it's important that we help them reframe their whole lives, understanding that they have a neurological difference, and help them really understand that they need to identify themselves by their strengths and not their weaknesses. So many of them will come in and say, I'm disorganized, I'm always late, I'm a mess, I'm overwhelmed. That's not who they are. That's what they're struggling with. And so we need to help them define themselves by who they are. I'm creative. I have lots of energy. I'm artistic. I have great ideas. Some of them are really beautiful, organized as far as their space, like they love to interior decorate, or whatever their strength is. You want to help them identify by that, not by their weaknesses. And you want to use this diagnosis as a change agent, so they can move away from that self-blame into self-understanding. Oh, my brain works differently. And you're going to give them a roadmap as to how to help them work with this different brain and how to understand it and what it needs to be successful. All right. So these are some of the sort of schemas and core beliefs that they often come into our office with when they have ADHD. They can't rely on themselves. They let themselves down. They have tended to have had failures or underachieved. And they tend to feel like they're incompetent or inept at handling even the basic demands of life, which just does not feel good. And this is especially so for women because, socially we're we're considered to be naturally gifted in managing a household and managing social activities and managing all those things that women are supposed to naturally do. So when you're a woman with ADHD, it does not come naturally. And so there's a lot of shame and blame and guilt around those incompetencies. And that is very sad. And we need to help women understand that there are ways to work around that, to delegate it, to simplify it so that they don't beat themselves up. And some of them don't belong as stay-at-home moms. Some of them actually do better in the workplace because they're more stimulated and more interested in that than in doing laundry and meal planning and cleaning and that kind of thing. So instability, they always find that they're chaotic and in turmoil and have unnecessary emergencies, and that doesn't feel good. Dependence, they feel like they can't handle it without other people stepping in and doing it for them, like maybe their finances or cleaning. And then they feel a lot of defectiveness and shame. And this is sad. And we need to really be aware of some of these underlying beliefs and schemas and help support them to change them. So they tend to have, unstructured. A lot of the traditional ways we treat them tends to be more unstructured and non-directive. And, even psychodynamically, interpretations of some of these behaviors can be really hurtful to them. Like if you say, well, you're late, let's look at why you're late, and make it a psychological problem rather than a time management problem or a time blindness problem or an impulsivity problem. So it's important to really be directive and hands-on and practical with this population and treat them a little differently than you might be used to in your training. So the first thing we want to do is help them optimize their brain. And that can happen through medication, meditation, and exercise. So as we talked about, it's fundamentally a chemical problem. So the most effective treatment is to change the chemistry with medication. It is not absolutely essential, and there are some people that don't necessarily need the medication if they're on the milder spectrum or have developed good compensatory strategies. And we'll talk about things to do in addition to or instead of medication. But for many, medication is just amazing. Like just yesterday, I met with a young woman who's a stay-at-home with young children, and she was on her first 2 weeks of the medication after I assessed and diagnosed her. And wow, it was just such a quality of life-changing experience for her. She suddenly felt competent, less overwhelmed, able to manage her children, start setting up routines for them, feeling like she could think straight, like she can focus, like she can follow through, like she can be productive. And she actually started to have time to take care of herself again, to work out, to have downtime, and to get more sleep. So it is profoundly helpful for many people. So there are, when they're not treated with appropriate medications, they're at more risk for higher levels of failure across their life, really, school, job, socially, self-esteem wise, substance wise, and risk-taking wise. Driving, some people are really risky drivers. They get impatient behind the wheel. They are impulsive. They're distracted. They have more accidents, and some of them are dangerous on the road. So it really impacts their safety even. So here is another scan showing with and without medication. This is, no medication is perfect. Some people are going to get a more benefit than others. It's really an individual experience. It isn't, so you can't just say Adderall is this way for everybody. Some people are going to like Adderall and their systems are going to respond well to it. Other people are not. They might do better with Concerta or Vyvanse. So the drug itself is not the issue as much as how each body responds to it. And it is such an individual response. So you can make some general conclusions about some of them, but it's really an individual, unfortunately, guinea pig type trial. We have to see how each person responds, what their metabolic rate is, how they metabolize it, and that's going to determine their individual response to it. And yes, there's some people that can't take medication, and we'll talk about that as well. So for those that can, what you're going to expect is an improved attention span, decreased distractibility, improved ability to start tasks and complete them, therefore they're more productive. It's going to help their working memory. They can be less forgetful, improve their efficiency and their processing speed, so they can read more efficiently and retain the information more easily. And they tend to be safer and have less risk-taking behavior. They are less overwhelmed. That's like the first thing I listen for. They have less sensitivity, irritability, and overreactivity emotionally. They feel calmer. That's another one to listen for, calmer. They feel calmer. Their brain is no longer buzzing around looking for stimulation. It's actually adequately stimulated so that it's calmer. It can calm down and focus and be more present. They are more patient and tolerant as a result. They don't seek stimulation as much. So the eating behavior changes partly because it is an appetite suppressant, but also because they're not seeking dopamine through food anymore. And they are then often less anxious and depressed because they are better able to handle things. So they're not as stressed out and worried about forgetting something, losing something, not getting something done. And that in turn will enhance their self-esteem, and it'll enhance their communication because they're more present. When you're more present, you're more effective at communicating than when you're distracted and inattentive and all over the place. So let's talk a little bit about medication management. Many of them are under-medicated because they want to get away with the lowest dose, or the doctors want to treat them with the lowest dose possible. So I always suggest the doctors titrate the dose until full efficacy is reached. That means that they really feel all of these benefits and not just partially feel them. One of the things you notice is that when they first take it, they will feel an initial improvement. And then when that wanes after a week or a few days even, that's usually a sign that they just don't have enough in their system yet, that the low dose was new to their body, so it felt more impactful initially, but it really isn't an adequate dose. Kind of like a baby aspirin for a migraine. So we want to make sure they're adequately dosed. And for women, there's some variability in their cycles, and their hormone levels at any given time can affect the experience of taking the medication. So some people need to keep that in mind and not assume it's not working if it's during PMS and they might feel a little more ADHD. And sometimes if they're on an SSRI, taking a little more of that can help. Sometimes taking a little more stimulant then can help as well. There are some people who medically cannot take medication for certain reasons to do with heart defects or other neurological issues. So it's obviously not a solution for everyone. There are non-stimulant medications that are also available that can be beneficial. So that's a second sort of source of treatment, like Strattera is a common one, Intunib is another one, Wellbutrin is another one. Those can all help with ADHD, and they're non-stimulants and don't have those side effects. There are also supplements that can be helpful. And then we're going to talk about non-medication related treatments, starting with how to optimize the brain with meditation. So meditation is not just relaxation. It's actually a brain training activity that will build new connections in the brain and over time, literally change the brain. It will help you in 36 different ways down to the cellular level. I wrote a whole chapter on this, and there are multiple benefits, not just to the brain, but to your health and your well-being, emotionally and physically. So I'm going to talk about what mindfulness is. Mindfulness is the awareness that emerges through paying attention on purpose in the present moment, non-judgmentally, to the unfolding experience moment by moment. So this is an active, not a passive experience. It's not trying to relax and clear your mind in quite what we might think of. It is a presence and an intentional directing of your awareness. Because with ADHD, it's the opposite. Your awareness is being pulled in different directions by the environment, or by stimulation-seeking behavior. So a stimulation-seeking can even be fantasizing or daydreaming. That can pull your mind away from what you're wanting to be attending to. So it's about being intentional with your awareness. And that really is like building a new muscle in your brain, because anytime you lose focus on the intended object of awareness, you bring it back to that object over and over again. So even if you have a monkey mind, it doesn't matter how many times you wander from the intended object of focus, it's the bringing it back into focus that builds the new connections. So it's about, bringing back that wandering attention over and over again, and also accepting and letting go of whatever you are attending to, even if it's a thought or a sensation, rather than following that thought or deepening that sensation. Let's say even you have a crick in your neck or a pain, or you've got a muscle hurt. If you focus on that, it's going to take you away from attending to the object of focus. So you want to just let go, relax that part of your brain, of your thought, and breathe into that pain or the sensation. Or if it's a thought, you just imagine it drifting by like a cloud. You don't attach to it. You don't follow it. You don't magnify it. So it's the letting go of and accepting whatever's going on in the present moment. So it's about attuning our attention to our own intention, which is the opposite of what people with ADHD experience. So it's non-judgmental. So we don't want to judge the thought or the feeling that we might have. They're going to pop in, and that's normal. We just want to not attach to them, not follow them, not judge them. So it's the repetitive act of directing your attention to only one thing in this one moment. So it's training your mind to pay attention to what you choose to pay attention, instead of letting your mind get hijacked by either emotions or by thoughts. So brain scans and other research studies have demonstrated the brain-related benefits of meditation, physiologically and cognitively. So the brain changes, including modification of the attention network that I mentioned at the very beginning, changes in dopamine levels, modulation of EEG brainwave patterns, and changes in neuronal activity. So these are real and permanent and cumulative changes. There are even changes in cognitive measures that you can measure in cognitive tests. So even under brief periods of practicing this, you can see significant changes in cognitive measures. So it is like a huge gift that people can give themselves if they start a meditation practice. The left prefrontal cortex is activated during meditation. So there are reported feelings of joy, enthusiasm, high energy, and alertness when this area is activated. There are dramatic increases in key electrical activity area known as gamma in the left middle frontal gyrus. You don't need to know about that, but basically it's an area of positive emotions. So it's a feel-good activity once people can relax into it and stop worrying about whether they're doing it right and just try it, practice it, build that skill set. It's like exercise, building muscles. You just practice, and the more you practice, the better you get at it. It does produce a greater state of neural integration. Cortisol levels go down and serotonin levels increase. As I alluded to, it is progressive, cumulative, and permanent, these changes. And it improves emotional self-regulation, working memory, and sustained attention. So here are some links to some meditation practices that some universities have used for research and for people to benefit from. This was a sort of a seminal study back in 2008 of specifically people with ADHD being treated with mindfulness meditation practices. And they found that 78 of them reported reduced symptoms, even though they were already on medication. And there were also improvements in neuropsychological measures and in reductions in depression and anxiety. And this individual, Lydia Zylowska, did create a book for the public, and it has a CD with her meditations on it. So this is just like a short one you can teach people to do just to get started, where you choose a position. You either sit erect or you stand, or you can walk or lie down, actually. You close your eyes or softly gaze downward, and you focus on observing the breath in and out of the nostrils. And as your mind wanders, you observe without attaching by saying, You have a thought, thinking, or feeling, or sound. And then you return your focus to the breath, repeating each time the mind wanders. That is one type of meditation. I also highly recommend apps on your devices. There are many of them that are very helpful, like Headspace or Calm or Insight Timer, Buddhify. I wrote them down the last part of this slide. There are different kinds of meditation practices as well. There are transcendental meditation, which is great, contemplative prayer, and different mindfulness practices, including things like Tai Chi, Qigong, yoga. They're slightly different, but they are all beneficial. You can also attend meditation workshops and classes and retreats to learn more about how to do it. And there are all kinds of websites where you can get free meditation guides and examples. YouTubes have meditations. You can find them everywhere for free. So I highly recommend people start a meditation practice, starting with 10 minutes a day. If they can't do that, 5 minutes a day is fine to start. I like Headspace because it has a built-in 10-minute a day practice, and it reminds you every day. And there's a free version as well as a more advanced subscription version. But there are many others that are great too. So just help them find one that works for them and have them try a bunch of them until they find one that resonates, because you have to like the voice, because these are guided meditations. So you have to like the voice and the music and the experience of it as well. If you're annoyed by the voice, it's not going to be helpful. So I get people to try several and find the one that speaks to them. Or they can do it on their own, like that example I gave you with a 4-minute meditation. All right, and then exercise. That's another really important way to treat ADHD and to optimize the brain. So exercise improves brain functioning and blood flow to the brain. It increases serotonin, dopamine, and norepinephrine availability, and it creates new receptors. As Dr. John Ratey says in his seminal book called Spark, exercise is the single most powerful tool you have to optimize your brain function. It significantly improves academic performance, test scores, cognitive flexibility, and executive functioning. And there's a strong relationship between movement and attention. There are shared overlapping pathways. So the areas of the brain that control movement also coordinate the flow of information. So often the best exercises are more complex and structured, like when you have to learn routines in martial arts or ballet or figure skating or gymnastics. It's not necessary. It can be helpful. That's why we suggest kids do martial arts and some of these other things. But if just any movement is good. Exercise in general helps regulate the amygdala, which is where the anger is triggered from, and improves the tone of the locus coeruleus, which blunts the hair trigger reactivity and rage reactions that some people have, and it reduces irritability. So the recommended exercise is 30 to 45 minutes, at least 3 to 5 times per week. The goal is to achieve fitness, not, to build big muscles. And so it's really just to stay fit and to help your brain and body in general. So it's not about, this high-powered routine or anything. So sometimes, people have a hard time developing the exercise habit. So you're going to have to help your clients do this. And having structure and accountability is one way to do that, where they pair up with a buddy, they meet someone or a personal trainer, they have regular scheduled classes they go to. You can help them add more movement to their day as they do normal things, using the stairs, parking further away, taking brisk walks, playing a fun sport that makes it more fun instead of having to go work out in a gym, or working out in your home like I do with exercise videos. Using a pedometer device or an Apple Watch or something that's going to count your steps or measure your exercise levels can be more motivating to some. Engaging in group activities is more fun for some people. Or using like a Wii Fit or a Connect, where it's, like playing a game, but you're moving at the same time. If you just want to encourage movement as much as possible and teach your clients how much it's actually treating their ADHD, permanently and cumulatively improving their cognitive functioning. And then lifestyle management is also super important to go through with your clients: sleep, nature, and nutrition. So chronic sleep deprivation is probably the most significant issue all of our clients experience, followed by stress management, nutrition, and exercise. So cognitive functioning is adversely affected by lack of sleep, by too much stress, and by improper diet and hormonal changes. Lack of sleep is the number one, the sort of the pillars. I talk about 4 pillars for treating ADHD. Sleep is one of them, exercise, meditation, and nutrition. So lack of sleep is going to adversely affect your executive functioning, your energy level, and your mood. You're going to, have a worse time with everything during your day. So it's super important to help people manage this. There are many common disturbed sleep patterns we see in our population, like delayed sleep phase syndrome, where they are night owls. They get a second wind. They feel like, okay, the kids are in bed. Now I have time to myself. And they start playing on their devices or binging on Netflix or something like that. And then they stay up way past what's healthy for them. And then they have difficulty, also some of them waking up, even after a good night's sleep, and some of them are still in a fog in the morning. These are common patterns. Racing thoughts can make it hard for them to fall asleep. And so we're going to talk about some ways to help with that, including not stimulating themselves too close to bedtime, which means turning off the television, the internet, putting away their phones, and not doing something too active right before bedtime. And that's hard to hear for many of them. But you want them to commit to getting roughly 8 hours a night, minimum 7. Some people need 9, but so 8's kind of an average to aim for. And really teach them that it's more important than that extra Netflix show or that extra hour scrolling, and to really turn those screens off and put their phones out of reach of their bed. That is so critical. I can't even tell you. It has changed the life of so many people. Just that one suggestion or recommendation that your phone is out of reach while you are trying to go to sleep. Because it is way too tempting to respond to a text, to check out a YouTube video, to scroll, etc. And help them create daily routines to support this. Have them make it a top priority. It's that essential. So you got to build in sometimes accountability using like I'll even have people text me what time they're going to bed if this is a big issue for them, just to have accountability. But sometimes it's helpful to have them have accountability to a partner. So if their partner is better at going to bed at a reasonable time, have them go to bed at the same time as their partner or their roommate. Or they might have a buddy they can text and say, okay, I'm going to bed now. But it's really important to teach them to prioritize the sleep. Again, putting off the phone out of reach. Sometimes having optimal background stimulation can help them fall asleep because remember, their brain is bored and looking for stimulation. So even if they're medicated, their medication is mostly gone at this point. So they're looking for stimulation. So their brain's pinging around and it makes it hard to fall asleep. So sometimes background stimulation can help their brain calm down and fall asleep. So my son used to fall asleep to a fan. That was essential for him. For others, it's a white noise machine or a nature sound machine or soft music or sleep stories or a radio talk show, some background that's not going to distract them too much, but it just gives them just enough stimulation to calm their brain down to go to sleep. So there's something called a body scan meditation that I've taught some people to do, where I like to start at my toes. You can start at your head, but you just lie in bed and you imagine, you kind of experience how your toes feel on the outside against the sheets, let's say, and you just feel into your toes, and then you feel into the inside of your toes, sort of the interoception of what your toes feel like inside, and then you move up to your arch and the top of your foot and your ankle and your calves and your shins all the way up, and you really focus on like putting your mind in that part of your body and experiencing what that part of your body is feeling. And it gets you out of your thoughts, your worries, and it's very grounding and very calming. Some people need to do a brain dump before they go to sleep because their mind is full of should have, ought to do, got it, oh my gosh, what if I forget this? And they're kind of spinning there. So sometimes just getting a piece of paper and writing down things so you don't forget it, or putting action items down so that they remember to follow through in the morning. Reading can be an effective way to fall asleep because for many, it takes a lot of energy and effort to read. And so it can make them drowsy, unless it's a gripping novel they can't put down. So you have to assess that. A relaxing bath is really helpful to some people to calm them down. And for some, there's even some PM yoga practices that are very calming. So help them find what works for them. So exposure to nature is also really important in reducing the symptoms of ADHD. So it makes help them find ways to get outside, even if it's just at lunch. If they're in an office, go outside for lunch, go take a little walk around the neighborhood, or go have lunch at a picnic table somewhere instead of in your office at your cubicle. Or if you work from home, that's easier to go outside and take a break, walk the dog, eat something, get outside. So that's really helpful. And they've actually done research showing that reduces the symptoms of ADHD. The more you are in nature, the ADD brain craves the peacefulness of nature. And many people just really feel their best when they're in nature. So they take hikes on the weekends or bike rides or things like that. And when you can get both exercise and be in nature at the same time, like a walk or a bike ride, it's a win-win, for two for one. And then nutrition is also an important pillar in managing ADHD, because what you eat, so garbage in, garbage out, what you eat determines what your neurotransmitters are and your energy level and your focus. So you want to think about a higher protein, lower carbohydrate diet to enhance energy and concentration and raise dopamine levels. And you want a proper balance between these things. But protein is really the essential part that you want to make sure to eat at all meals, especially at breakfast, because most people are used to breakfast foods being starchy and sweet. And what happens is you get an immediate pop of dopamine and energy, but then and blood sugar raise, but then your blood sugar levels will drop because the insulin's released to process it, and then you have kind of a down part when your body's going to crave sugar again, and you're going to feel foggy and low energy, and that's not what we want. So we want to maintain stable blood sugar levels by fiber and protein in the morning. And so protein and fiber also will stabilize the sort of insulin sensitivity that we see in our clients. So we want to really include help in choosing what we eat. So healthy protein choices could be, if you eat meats, chicken, turkey, very lean beef or fish, or dairy like low-fat cottage cheese, string cheese, milk, yogurt, kefir, soy, protein powder, eggs, nuts, seeds, legumes like beans and things, and quinoa. So these are all healthy protein choices, and you want to help people find ways to incorporate them in all their meals. And I do a lot of talk, even with kid-friendly stuff, quick grab and go stuff. If they're in a hurry, it's better to grab something healthy than a sugar-loaded sort of processed granola bar or donut or Pop-Tart. I mean, those are like the worst things you could do. So we really want to think about watching things like fruit juice and fruit juice intake. Orange juice in the morning, that used to be what we were raised with. It's actually not a healthy choice. It just spikes your blood sugar instantly. Don't do that to yourself or your kids or your clients. So breakfast ideas, things like omelets, you can put vegetables in it, or you can have bacon with it, or turkey bacon or cheese, or just even an egg on a whole wheat toast or something. So there are some cereals that are well made that have high protein, high fiber, and low sugar. There is some a company called Elizabeth or Kashi, where you can get really like ancient grain granolas with seeds and nuts in it, with milk or a milk substitute, and some fruit maybe on top of it, cottage cheese and fruit, or Greek yogurt with fruit, whole grain bagels and cream cheese, or there's some good quality, let's say whole grain waffles that some even have protein in it. You could put maybe a nut butter on top of that. Some kids will like that. My daughter used to have those round, really good quality waffles with like peanut butter and then another waffle and walk out the door with that. Or you can make protein smoothies. So you can throw in either yogurt, a protein powder, or a nut butter like peanut butter or almond butter as the protein, and then put some fruit in there and either milk or water, and maybe some seeds like flaxseed or chia seed, and you got a really healthy breakfast. Apple with peanut butter or a nut butter. So these are some possible options to suggest. So here's an experiment that was done to show how kids' attention will deteriorate more with more cereals that, like Cheerios is the green one and the blue one is Shreddies. No breakfast is the red, and a glucose drink is the yellow. So their attention level will be determined by, so higher score is worse, will deteriorate depending on what they've eaten for breakfast. So we want to give them some good solid breakfast. We also want to make sure they have some omega-3s in their diet. It's important for your brain structure and function. So, supplement or have that as part of your diet to achieve those benefits. We tend to have, too much of the omega-6s, which we find in a lot of the corn and soy products, rather than more of the omega-3s. So that's where we want to supplement in particular. And you can get it naturally through tuna, salmon, walnuts, Brazil nuts, fish oil supplements as well can be helpful. And it can help with ADHD symptoms. So meal planning can be really challenging for people with ADHD, and we need to assist with that because it is a kind of an executive functioning multi-step process. Because you got to think about what you want, you got to make sure you have the ingredients, you got to go shopping, you got to prepare it, maybe you got to marinate it. So this can be a challenge for them to eat healthfully. And they're often overscheduled and their families are rushing to activities and they have to, they rush to a fast food restaurant or takeout food. So it can help if they create a weekday meal rotation menu plan by listing like 2 weeks worth of simple menus to repeat every 2 weeks. And that will simplify their shopping list and they don't have to think about it. They just know, okay, tonight's taco night. So, I know that I already have that because I planned for it and I can create the meal more readily when they have a sense of what they have to cook. Some of them will do better with online grocery shopping because they get lost in the shops with too many decisions and it takes too long and they get sidetracked. So some people actually with ADD find that the online shopping is very convenient and helpful for that. It's helpful to have them use a shopping list rather than, be tempted by overbuying impulsively. To have grab and go healthy breakfast available when they're rushed so that both them and their kids can have something healthy that's quick, and set up some pre-packed lunches for the week each Sunday with staples that are healthy sort of in that one part of the refrigerator so that you can just add the part that needs to be very fresh at the last minute, either the night before or that morning. So thinking about how food is managed is important as well as what we eat. All right, so I'm going to move on quickly to some compensatory strategies so I can have time to address some questions at the end. So part of what we have to help them compensate for is developing, better habits so that they are on time and they can be more organized, et cetera. Help them manage stress, help them problem solve. We can do that to some degree with doing some coaching for them and also helping them get an ADD coach if they need one. And some assistive technologies are really helpful because we have reminders and built in all kinds of electronics things that are very supportive to this population. So as I say, there are good things about the electronics and not so good things about it. But habits are difficult for them and they need our support in developing those healthy habits of getting enough sleep, getting the exercise, meditating, taking their pills if they're taking them. All of those things are habits that we need to help them develop. So many of them will say, if it weren't for bad habits, I wouldn't have any habits at all. So they do need more structure, accountability, and support to develop those new habits. And the more they do it, for the average person, I think it's supposed to be 21 days. They need probably more like 36 days or more. So we need to really support them, especially if they have a change in their schedule, like they go on vacation or they're sick, then it's often hard to restart the habit. So they need more support in doing that. So basically, this is just a paradigm I kind of invented to help people think about habit development, but you want to select a new behavior, let's say going to bed on time, and have them do it for at least 21 to 30 days. And that's why I will let them text me what time they went to bed, just as a way to support them. And it feels like they have some accountability that way. You can pair it with another habit that they normally have. Sometimes, like let's say they forget to brush their teeth at night, or they need to take a pill at night. If they normally do remember one of those things, you pair it with one that they do remember to kind of help them get into that habit. You can set alarms or electronic reminders, and building an accountability is super, super helpful. Sometimes if you have a spouse that is better structured and going to bed at 10 o'clock instead of at midnight, try to go to bed with your partner. Check up on their progress regularly and creatively problem solve with them to help them establish the habit and adjust the plan as needed, collaborating with them. Okay, so that didn't work. What can we figure out that would help you get to bed on time or take your pill or whatever the case is? and then solicit help with an ADD coach if needed, if this is not sufficient support or you don't have the time to support the habit development. And in general, we want to help our clients to create a more ADD-friendly lifestyle. So we want to simplify it as much as possible, delegate as much as possible, and eliminate the things that are really hard for them. If bill paying is something that they mess up on and they can't keep track of, they shouldn't be the one paying the bills. They need to automate payment as much as possible, as an example. And sometimes you do need other resources like an ADD coach. A professional organizer can be really helpful in coming in. They're trained to help set up systems in their homes or in their offices and declutter for them. And sometimes a cleaning service is like a life-saving thing, because some ADD women just really, or men, don't do well with cleaning. It's just too difficult for them to stick to it and consistently do it, and it takes too much time. So it's like, I'd rather see them do a little part-time job to afford a cleaning service than have to struggle with the cleaning themselves, if possible. Or barter with a friend, get a clutter buddy to come in. I'll declutter, help you declutter your space if you help me with mine. That can work too. And then we want to teach them, to kind of reframe their ADD and understand it from a neurochemical perspective and not from a blame and shame and I'm bad, I'm stupid, I'm inadequate perspective. Focus on their habit development, identify from their strengths and not their weaknesses. We want to teach them some executive functioning skills, like how to schedule things, and all of that is really important. I have a feeling that I am going to probably skip some of this part because it's probably not as helpful, and I want to make sure to take time for some questions. So this is just about a CBT study where it just shows that you can teach some of these things about how to use a planner, and here are some things about what you can do to enhance executive functioning by eliminating distractions. You'll have them in the slides. So I'm going to, in the interest of time, just share it to you, in your handout, because it's not that important, I think, for us to go over some of these. So this is just a quick review that when you treat these people, we want to help them with improving cognitive functioning, with developing good compensatory strategies, with restructuring their environments, with creating a more ADD-friendly lifestyle, and then addressing all the emotional aspects and fallout of their ADHD. And that we need to be their frontal lobe for a while and help them develop their own frontal lobe through habits and structure and accountability. And we need to coordinate among other caregivers, like the medicating physician. I say medicating physician because it could be a nurse practitioner that's treating them, or a psychiatrist, or a regular GP. Sometimes we have to coordinate with an organizer or a coach. Sometimes we have to refer them for further neuropsychological testing or neurofeedback or other supports. And so, we want to keep a structured session. We want to, kind of focus on what's going on in their lives, but also concurrently work toward these good habits. Check in on, are you taking your meds? How are the meds working for you? Do you need more meds? And then you can talk to the doctor about asking for a higher dose, and addressing, that kind of thing, as well as reviewing what you're teaching them at the end of the session. And I also have them do things in session. Like if they can't remember to make a certain doctor appointment, I'll actually have them in session make the appointment, or do whatever simple task it is, or put the reminder on their phone, or put the alarm on their phone in the session. So it's very practical and hands-on, and different from more traditional psychotherapy in those ways. So this is sort of having them write things down, having them have a therapy notebook, because I give them a lot of resources, a lot of guidance, a lot of advice, and having them have a place to record that is really important. All right, and then you're going to get these resources in your handout, so I won't necessarily go over them. They're just sort of books and different resources online for you. So now I want to take time to share some questions and answers, and I'm going to open it up for that. Let me look at the chat. So ADD coach. Oh, and one of the things I skipped over is there's something called focusmate.com that it's in the slides, but I wanted to make a special point to tell you about it because it's been a lifesaver for many of my clients. Focusmate.com is a virtual accountability and support partner, if you will. So it's It's very affordable and very accessible. So you would go online to their virtual calendar, you schedule an appointment, you get matched with a buddy to do a task at that same time. You tell each other what you're going to get done with your work session. You put each other on mute in the background and you do what it is. And the what it is could be declutter your closet. It could be get yourself to do exercise. It could be get a task done, pay your bills, anything. It is so cool because it's right point. You can get it on your phone or on your device. And it's only $5 a month for unlimited use and free up to 3 times a week. So tell your clients about that. Let me open the floor to questions. If you want to verbally ask me one, feel free to. And I know there's some information going out there online for you. I could speak about ADD for days, so obviously cannot cover everything. But I tried to give you a good overview as much as possible with the time constraints that I had. So does anyone want to unmute and ask a question in the last couple of minutes here?
I think are there some unanswered questions in the chat?
Yes. Yes, and I've answered most of those so far that I'm seeing. Taking meds every day. Okay, taking meds every day versus when they feel like they need to concentrate. That's a good question. So generally, I recommend taking it every day, but it is a choice. And the nice thing about this kind of medication is it's easy to do a trial with the stimulant medications because it's out of your body at the end of the day. So you can choose not to take it the next day because you're on vacation or because you have a very light day or weekend or something like that. That said, there are also many people who find that they function and feel so much better when they're on the medication that they choose to take it every day. My son used to ask for it because he felt better on it. And I have plenty of adult clients who just feel like they're more focused, they have more energy, they're calmer, they're more present. And you have to be present in your relationships, even when you're not working or at school or in an executive function demanding situation. So it affects so many domains of your life that most people find that they want to be medicated all the time, every day. But again, it's a personal choice and it depends on how severe your ADD is, how well you compensate. There's so many ifs, ands, and buts about that one. So recent studies on microdosing psilocybin, yes. I don't want to comment on that one because I have not researched the psilocybin for ADHD specifically. It could be good, so no comment on that. Low doses of estrogen, yes, positive effect. So yes, as people go through perimenopause especially, or have dysregulated periods, being on birth control can have a positive effect on regulating hormones that will then also help with ADHD, especially as you go through perimenopausal changes. Walk, run therapy in future could be beneficial for clients. Yes. Walking with clients can be helpful for those that have a hard time sitting still. I have some great upholstered chairs in my office that swivel, and some people will swivel or rock in them. I have a basket of fidgets right next to my clients so they can grab onto something and fidget, and I have a notepad and a pen there so they can always grab something if they want to take a note. So those are kind of some ADD friendly accommodations you can have in your office. If a young adult or teenager refuses to take medication and doesn't want to change their brain and approaches the diagnosis with inflexibility and defiance, well, you can't make someone treat their ADD, but hopefully you can get them tied into the effect on their brain negatively. So are they struggling more in school? Are they having trouble socially? Are they tired a lot? Are they having to work extra hard to get through school? All of those things might have some buy-in. I often will show the brain scan, and now you're going to have them in your handouts as this is really what's going on chemically. It's not that you're not smart. It's that you don't have enough dopamine. So having more dopamine is going to help you feel better and function better and be your best self and achieve the most in your life. All right. So I think I covered all the other ones I see. If there's anything else, please pop in, unmute, and let me know if you have another question.
I think Alexandra had a question, if you'd like to ask, Alexandra.
Yeah, I did. I was going to ask about the potential addiction to some of these meds, and if you could discuss also withdrawal when and if you get off of them, and some other potential side effects like maybe weight gain and things like that?
Sure. So
Oh,
certainly meditate.
I'm sorry. Also, maybe talk about tolerance, like when you start building a tolerance and having to keep increasing the dose. Yeah. Thank you.
So medication can certainly have side effects. The most common one and one we expect is some appetite suppression. Many adults wish it had more of that impact because they would like to lose some weight and stop binging or, eating dopamine seeking eating. So it will have some appetite suppression. We need to work around that. We need to make sure they have a good, healthy breakfast with protein and fiber, and that they eat protein and fiber in the middle of the day, maybe just an apple and peanut butter or some Greek yogurt or something. It doesn't have to be a huge meal if they're not hungry, but they need to fuel their body and brain, or else they will crash later. And they'll crash because they don't have enough fuel for their body and brain because they didn't eat it all day, and then they're starving by the time the medicine wears off. So appetite suppression is one thing to work with. Some will find that as they first start the medicine, there are going to be some initial side effects that go away. Sometimes a slight headache, sometimes slight nausea. That tends to dissipate as their body gets more used to it within the first few days. So if they can hang tough with that, that can be helpful. Unless they're really severe, of course, then you stop it right away. Occasionally, you're going to have more adverse results. Like my son, at one point when he was very little, 6 or 7, he got sort of some tics or some jaw like clenching, and his jaw was really sore at the end of the day. So we changed the medications. So you could certainly look for that. Some will get more irritable and more emotional on it. You have to look for that. And sometimes that one develops later. So it may not be noticeable at the beginning, and then you start noticing a pattern that they're even more irritable and more dysregulated, which is the opposite of what you want. So again, it's a small percentage, but one to keep in mind. Some will have, everyone will have somewhat of an increased heart rate. It's not always noticeable. It's usually within a normal 10% above what their normal heart rate is. So it's usually, for a healthy person, not an issue. Obviously, if they have cardiac issues, you have to have it cleared by a cardiologist first. Those are the most common ones. As far as tolerance, there are some people who develop tolerance, thankfully not the majority. Usually it's because they haven't reached the full clinical efficacy at the beginning. So it's the sort of the ramp up where you might start with the lowest dose as usual, and then the lowest dose doesn't become sufficient after a week or so. Then it's just a matter of titrating it to the optimal dose. It tends to be sufficient long-term for most people. For those that do develop tolerance, then we have to change medications. And thankfully, there are many, many of them now available, many formulations that you can switch to. So that's helpful for those that do develop tolerance. It is also super helpful for kids that are learning to drive, because they're much, much safer, more attentive drivers, and you're going to have fewer accidents and just safer driving overall. Hopefully that answered that question. Yes. Caitlin.
Yeah. Just sort of following up on that, I work with a lot of young adults who are, I think, now addicted to cannabis. And I think it's an ADHD self-medication situation, but they've been doing it for so long that it's also like, or did the cannabis cause the, you know what I mean? We don't know, because they've never been willing or able to get off of the cannabis. And when I've worked with psychiatrists, they don't want to put them on a stimulant while they're smoking marijuana like multiple times a day. And so I was just curious about the, do you think you have to get off cannabis altogether in order to make a more accurate sort of diagnosis, or that, because then
I don't think you have to get off of it, because these patterns predate their marijuana use. So you want to really pay attention to the earlier years before marijuana was introduced. You want to look at family history. And yes, it is one of the most common self-medications for ADHD. Their brain is looking for something.
Yeah.
And it calms their brain. And so then they develop a habit of it, and it helps calm their brain down to go to sleep. And so, yes, many people will use it that way. And I try to get them to cut back, and I have many people that are on stimulants and also using pot, but I try to get them to really cut back on their pot so that we can introduce the stimulant, and so that they can see that the stimulant will get them what they need and they won't need the pot as much. But yes, it's a problem. Absolutely. A big problem.
And I didn't see the slide really quick with melatonin, because then there's also a lot of people now using melatonin. And I
Yeah.
think
And that can be a problem too. Yeah.
but how do you help people with ADHD sleep?
That's why I gave you a whole slide on sleep strategies.
Okay. Okay.
So to look back at that slide, all the different ways you can provide optimal stimulation so the brain can go to sleep.
Okay.
So yeah, that's on there already. Somebody mentioned Wellbutrin as a question. Wellbutrin can be very helpful for ADHD for some people, especially those that can't take stimulants. So it's a good one to try for people that are having problem with stimulants. It can be definitely helpful for many people. Other questions? I know we're over 11, so I'm not insulted if you want to get the hell out of here, but I'm also happy to stay longer for those that want more questions answered.
I know I stepped away to use the bathroom at one point, and I'm worried that you answered this question, but as texting, why is texting particularly difficult for folks with ADHD?
I did answer that, and I don't agree that it's difficult.
Yeah.
I mean, I haven't heard that it's difficult. Many people are very much into texting with ADHD, so that was news to me that it's difficult for people with ADHD. What
mean
is
they don't
difficult
respond?
often is returning emails. They tend not to look at their emails, and they tend to get behind at returning them. They are much better at returning their texts. And not all of them. Some of them will ignore the text just like they ignore the email and the regular mail. They will ignore all of that because it feels overwhelming. That's why you're getting bombarded constantly by things to attend to. And so they can't deal with it all. It's like things coming at them constantly, and they don't have the executive functions to kind of manage and prioritize that. So they just kind of shut down. They don't answer the text, the email, or the regular mail. They don't even open it. It piles up literally. So that they won't answer the texting is because it's just like it's like a distraction and an interruption, and it's too much effort, and so they stop answering. Others are good at it. It really depends.
Do you have a resource that you feel like is client friendly? Because this is a lot of information, which of course we can probably share and try to dilute, but are there like things that would, maybe be a helpful description for people who are trying to, to understand this a little bit better?
Yes, and you'll see that in my resource slides, which you'll get in the handout.
Okay.
There are some good. So CHADD is Children and Adults with ADD. So CHADD.org is a hugely helpful website. They have so many cool things. They have webinars, podcasts, some of which I've created. They have handouts, they have virtual groups, they have articles, they have everything you could think of for ADD in every aspect of it. ADD in the workplace, ADD in school, ADD in women, everything. So that's a hugely helpful resource for most people. And there are many more I've listed in those 2 slides, which you'll get copies of.
Okay, so I think maybe we'll just wrap up here in a minute. There's one more. It looks like Cecile is asking if you have time for a comment instead of a question.
Yeah. Mm-hmm.
Okay.
Hello. I didn't
Hi.
realize that this was the attendees are mostly like practitioners, but I was just really interested because I think I may have ADHD, and it's very hard to find resources here in Hudson Valley. Like I did, like a Google research looking for people who might be able to help me, like maybe get diagnosed. And so I was so excited when Ashley and her company initiated this. I do wanted to say that it felt very validating, in both kind of like in the positive way, to see that like, wow, okay, there could be possible positive attributes to this, and at the same time like empowering, because it means that we can live like healthy, balanced lives. At the same time, I'm also a professional organizer, so I actually help people get themselves organized. So it was a wonderful event. Thank you so much for organizing. Thank you, Dr. Robbins, for all of your insight today.
Very welcome. Glad it was helpful.
Okay, well, thank you everyone so much for carving out this time and dedicating yourselves to being here. Dr. Robbins, this was so jam-packed. I swear I have learned so much during this one presentation. And I really can't wait to get in there with my clients. So thank you so much. I think we need to have you back and have you talk more. It just seems like we could go in a few other directions.
Oh yeah.
Yeah. All right. Well, I hope everyone has a lovely weekend, and we'll see you back here at the next Learning Lab.
Thank you.
All right,
Bye-bye.
everybody.